It's actually the 1-year anniversary of when we did the podcast talking about COVID and the impending lockdowns. March 9th, 2020, Richie Ote and I got together in the studio and did the last podcast I did in a studio face-to-face with people. Hugged Richie before we filmed and recorded. What a year it's been. If you told me then in a year we'd still be in a pseudo lockdown, I would have told you that I thought COVID would be going on, but we certainly wouldn't be in lockdown. Also, if you told me at the time that we'd have a vaccine that's 98% effective, and more importantly is 100% effective across all 3 of the approved vaccines in the United States for preventing hospitalization and death, which is really the only number that kind of matters, I would never have believed you. I would have thought that was impossible. And so both a year in hindsight that was incredibly challenging, so challenging it's become cliche, and yet we're sitting on the precipice of such hope. My mom is fully vaccinated at this point. I'm volunteering here in San Diego shortly to do at the Petco Park Vaccine Supercenter to earn my vaccine. With all that said, the other thing I've never thought I'd see, or never is probably a strong word, but I'm surprised I'm seeing, is some of the insanity I'm seeing on social media. One of the things I'm seeing lately is posts that are fighting what they're describing, for lack of a better term, as vaccine shaming. They're saying, don't give someone grief for not wanting the vaccine, for not, they're trying to turn this into a liberty or personal liberty issue, that trying to make someone or strongly encourage someone to take a vaccine is the equivalent of, say, trying to make someone take an antidepressant if they're struggling, or trying to make someone, do any other personal health issue. And that's totally insane. I cannot understand the lack of critical thinking that's going into these posts. And there's almost nothing more frustrating than the disinformation that comes from the anti-vax community. Let's just start with this. COVID is an infectious disease. It's not the only infectious disease, but it's an infectious disease. You know why that's freaking different than depression or alcoholism or heart disease or cancer? Because none of those are contagious. The reason you get a vaccine, and the reason society should push you into getting a vaccine, is because if you don't get the vaccine, you might kill somebody. I can drink all day long and I might kill myself on accident as long as I'm not driving, but I'm not going to accidentally drink you to death. Same with I'm not going to depress you to death. I'm not going to give you a heart attack to death, and I'm not going to give you cancer to death. Those are personal health issues that I personally deal with, and we all deal with. There are such things as personal health liberties, and then there is such a thing as public health. The reason why it's okay to have bans on smoking is because smoking actually can cause other people to get cancer. You turn cancer into an infectious disease with cigarettes. Therefore, you can ban smoking. COVID is an infectious disease that can kill others. So it is ridiculous out there, the lack of critical thinking that's going on in the public sphere. And it's scary. And we as a society need to fight it. And so what does all this have to do with business? Why am I ranting about this here in an e-commerce podcast or a business podcast? Well, if you don't think vaccination has anything to do with business and e-commerce, you're thinking way too myopically. The fact of the matter is, anyone in a leadership role has to make decisions if you take some time to think about the concept of leadership, by the very definition of filling a void. Leadership is making a decision in the absence of someone else or some already decided thing. So you're making a decision. All decisions contain risk. In this case, is it worthwhile to push a vaccine, to encourage a vaccine, or even to mandate a vaccine if you're in person to your employees? Is it okay to be public about it? And to me, the answer is unequivocal. Yes, you do that. This is a public health statement, and you will save lives by doing that. So as the world focuses on vaccination, what should we ask of our workers? How are we required to help? And how does vaccination connect to a thriving business? So we'll talk about all 3 of those things today. I'm Rick Wilson, and welcome to Dragonproof. So, one of the first things you have to think about as a business owner, entrepreneur, business leader is, what are your legal concerns around this? This is a touchy subject. And sure, there's OSHA, the federal government regulations around workplace safety and security. But OSHA is going to, like all things in the government, takes a while to catch up or do it right. So, really the questions you have to ask yourself is, what are your legal obligations for creating a safe workplace? Think about things like this. You have fire extinguishers at your workplace. You have exit signs on how to get out in case there's a fire. If you're big enough, you probably have a defibrillator on the wall. If you also probably have a first aid kit. So all those things are the kind of things that go to creating a safe workplace. And, the fact of the matter is, even though these things vary by state and federal law, employees, and I think rightfully so, have come to expect their workplace to be safe. Even if it was legal to do so, I wouldn't make my employees walk along shards of broken glass on the floor to do their job. That would be ridiculous. And so here in this case, you've got a situation where the government is going to lag behind, most likely, in regulations, and you want to understand your local laws and encourage a safe workplace for your employees. It's good for you, it's good for your employees, and your employees will thank you for it. So the first question is it realistic for employers to require vaccination for in-person workers? And so I think, is it realistic? Yes, it's totally realistic. And everywhere that it's legal, I would encourage every business person who has an in-person workforce to do it. I know we're going to do it. Now we're going to do it pending state laws. So if there's a state that doesn't allow us to do that, that's fine. MIVA has the benefit of being a remote first workplace where people can work from home. So if someone has some reason, even if I disagree with it, why they don't want to get vaccinated, they can work from home. But for in-person events and in-person experiences and workplace, we are going to require vaccination wherever it's legal. Is there other kind of healthcare that's mandated? Well, if you think about it in the most basic level, it's mandated at a restaurant to wash your hands when you go to the restroom. So the fact of the matter is there's a ongoing and various level of healthcare mandates depending on what you do for a living. Healthcare workers specifically have lots of mandates about what they can do. You obviously certainly wouldn't want your surgeon not disinfecting himself before he cut you open. So it is totally legitimate for workplaces to set healthcare mandates depending on the scope and variety of work they do and the situation. And that begs the question, what's the difference between requiring a mask in store or in the warehouse versus requiring vaccines? Well, I think it's self-evident and historically precedented that you can require masks. If I can require shoes and if I can require a shirt to provide service, I can require a mask. Businesses have long been protected for requiring uniforms. So there is no legal question, at least in my mind, that you can require a mask, both to customers and to your employers in all circumstances. Or at least all circumstances where it's humanly possible. The question about requiring vaccines in warehouses, I would encourage anyone who has a warehouse where people are going to be in close contact to require vaccines if it's legal in their area. I think in all cases, what you are doing is what's best for your employees, and that's ultimately going to be what's best for your business. So all of this begs an obvious question. As leaders, what are our moral obligations in this case? Last week, I was reading an article that was in Axios about vaccine hesitancy. And it's so sad that this has been politicized. It's just ridiculous. And there's a lot of headlines in the media sphere, if you will, about specifically Black people and people of color having vaccine hesitancy. Yet Black people, Hispanic, Latino people of color have at least a historical reason to have some distrust. They've literally been tested on as public health experiments and lied to. Yet they're not the ones who have the highest vaccine hesitancy. They are running around 30% with hesitancy, not saying they're not going to, while white Republicans specifically have 56% of that subgroup have vaccine hesitancy. Well, why? I mean, I hate to break it to them. They're not the oppressed ones in this country. And they have not historically been tested on. They actually have historically received the best healthcare. And so why are they so hesitant? Well, because they had a leadership void, or they actually had proactively bad leadership. I don't want to politicize this heavily political issue already anymore. So I just want to talk about, is it a touchy subject as the leader of an organization to take a stand on this? And the answer is yes, it's touchy. The other question that begs is, should you? And the answer is yes, you should. The point of being a leader is to take risks, make declarations, do what is right. And you know what's right now? What's right is to protect your workers and protect yourself. So is it a good idea then to give them time incentives, time off? Can you afford to do it? Absolutely. just like voting, just like getting a flu shot. We have flu clinics at Miva, at least back when we were in office. And if you couldn't make the flu clinic, we would give you time off to go get your flu shot. And the flu shot was nice. It was arguably selfish on Miva's behalf because we didn't want the flu running through the office and decimating us because people being out for a week for the flu. Well, when people are out for multiple weeks because of COVID, or God forbid, one of your employees dies or they have relatives who die from COVID, what does that do? So even from a selfish perspective, you want to make sure your employees get vaccinated and protect themselves. And then that also leads to the final question right here. That's a moral obligation for leaders. I mean, you didn't become a business person to not be a leader. And if you're still struggling in that, take some time, but you're a leader. And so the question is, should you or your business use its social media and other outlets to encourage vaccination? Should you ultimately take a public stand on where you stand on this, or keep your mouth shut? And, this is not just about COVID, but this topic is a topic of, I think this is something we'll probably come back to on podcast after podcast and maybe touch on in books and blog posts. But I believe unequivocally that in this particular case, where there is a clear public good, that you should absolutely take a public stand. This podcast you're listening to right now is a perfect example of that. This is a public podcast. I am making it known. I just talked about white Republicans being vaccine hesitant. I'm going to break it to you. A lot of my customers are white Republicans, and I care about them. The reason I'm not taking a shot at them, I'm not even taking a shot at them, but I'm not taking a stand against what many of them hold as a hesitancy to shame them or to argue with them. I'm taking it because they will be healthier if they get the vaccine. And so you should take a stand. Any opportunity you have to be a leader in this case, you should take a stand. So let's zoom out a bit. Why am I talking about this? I wrote a book about competing online in the age of Amazon. What on earth does this have to do with any of this? Well, I think it breaks down into a few things. There's a bigger topic here that ultimately represents team thinking versus every man for himself. Now, I grew up, I'm a business person, and I'm very pro-business. And what I mean by that is I believe the entrepreneurial spirit is a great part of the human condition. And I am supportive of entrepreneurs. It's the reason I do this podcast. It drives so much of what I do in my business life. And I can tell you, as someone who's studied and been around this my whole life, there is a vein within entrepreneurialism, and I have studied and fallen into that vein at times of thinking I'm doing it all myself, right? But let's use Miva as an example. Miva requires a number of things to exist, as does anyone's business, especially an e-commerce business who's listening to this site or listening to this podcast. The internet, let's just start with the simplest thing. Without the internet, there's no Miva. And without the internet, there's no e-commerce stores. Well, how did we get the internet? We got the internet because DARPA, the research project of the Defense Department, which does all the cool, interesting technology things, they invented the internet, a multi-node distributed network back. I think they developed the concept in the 60s, and they started commercializing it in the late 80s. And so really, none of us would be here if it wasn't for this DARPA project that started about 50 years ago. So sure, are you responsible for your success? In many, many ways. But there is no such thing as living on an island or succeeding on an island. And if you think about just now, let's zoom in a little bit and let's talk about your business. If you have an e-commerce business, which I'm going to assume if you're a listener, how many different people, partners, external systems does a typical e-commerce business interact with? Let's just start with software. In order to sell something on the internet, you have to connect to a payment gateway, which is in order to process a credit card. You're going to connect to a shipping carrier to get rates and print a label. You're likely going to connect to a sales tax service to calculate sales tax. That's just 3. There's a very real chance, if you go look at almost any e-commerce website, that there's a dozen more that they're interconnecting with, whether it's an ERP system, an inventory management system, a marketing tool that's helping drive recommendations and conversion. There is no such thing as a business that does not interconnect with other businesses in order to function. And that is no different here when it comes to public health and our role in protecting our employees and our customers and each other when it comes to this public health crisis that is COVID. So let's talk about one more thing here. We want a healthy public. It's weird that I have to say this, but we want a healthy public. Imagine if there's no one to buy your goods. Imagine if there's no one to deliver your goods. Imagine I was talking about this with someone not long ago, that about 1 year ago, in hindsight, and I don't talk much about Miva here, but in hindsight, Miva had a banner 2020. We had a really incredible year. But a year ago, when pandemic hit at the 1 year anniversary of this podcast, I wasn't sure what was going to happen. I didn't know if Miva would survive the pandemic. I didn't know if any of us listening to this would survive the pandemic, either physically or business-wise. And so you have to have a healthy public to have a healthy business. They are literally connected. It sounds cliche to think about the greater good. I am ultimately a capitalist. I believe in the profit motive. But part of the profit motive is understanding that a healthy and functioning society is the greater good. If we don't have people to deliver our goods, or better yet, people to buy our goods, then we don't have a business. And so it is both for the greater good, but also selfish at the same time to want a positive, healthy public situation. And that's why public health is important to us. It's so easy to forget that. We take so much for granted as far as there's groceries in the house and there's customers on your website. But really, we are part of a greater interconnected ecosystem, not that different than a garden or the ocean or just about anything else. And so public health is a critical role for leaders to take a stand on. So thank you for joining us. If you have feedback on this episode, send me an email or hit me up on Twitter, and we'll talk to you soon.